The MAJIC study, we'll be presenting some updates from that and some first-line results, in fact, at the EHA 23. MAJIC is an academic study which is being carried out in the UK where we compare ruxolitinib with best available therapy in two cohorts of patients. ET patients who are resistant or refractory to hydroxyurea. We presented and published that study in Blood. It was one of the top 10 manuscripts in Blood, showing actually equivalence of ruxolitinib in this context. Secondly, we have a second study looking at polycythemia vera patients also resistant or intolerant. This is the primary data that we will be presenting at the EHA meeting. Here we were able to show good and deep and rapid responses to ruxolitinib when compared to best available therapy. We show greater responses than in the commercial trials. We also show greater durability of response, and for the first time we show a hint that there may be reduction in transformation risk with ruxolitinib. That means less risk of transformation to leukemia or myelofibrosis. And this is very important for patients in treating this very indolent and long-term disease. Secondly, going back to the ET cohort, we have an oral presentation made by Jennifer O'Sullivan, who's a very talented PhD student, between myself and Adam Mead, looking at molecular signatures, looking at molecular responses and additional mutations, and able to show prospectively in a clinical trial that particular combinations of molecular signatures are associated with worse prognosis. Not some very surprising results, I would say, TP53 for example, but some other candidates that were a little bit surprising, SF3B1 being associated with poor outcome, but also for some of these mutations that ruxolitinib was able to overcome that poor outcome when compared to best available therapy.